we are looking at arterial septal defect. When we say arterial septal defect, it is a congenital abnormality. Normally, if a fetus is in utero, it is not a problem because we know very well if a fetus is in utero, the arterial septal defect, there will be shunting of blood between that two places, and it is not an abnormality. It only becomes an abnormality after birth if it refuses to close. This arterial septal defect is supposed to close after birth. So if we have a situation where you have given birth to the child and then it has refused to close, it has now become an abnormality, arterial septal defect. Arterial, it means that the defect is between the two atria. It's between the left atrium and then the right atrium. Septal means a wall. Septal means a wall. Defect means a hole or abnormality of the wall. That is the septal defect. Any abnormality of the what? The septum. So arterial septal defect, because there is a hole in between the wall that separates the left atrium from the right atrium, there will be shunting of blood from the left atrium to the right atrium. And this will lead to an increase in pressure of the right atrium. If there's increase in pressure of the right atrium, where is the blood going? The blood will go through the atrioventricular valve or the tricuspid valve to the right ventricle. From the right ventricle, that same blood will pass through the pulmonary valve. From the pulmonary valve to the pulmonary artery. From the pulmonary artery, is going straight to the lungs. It is going straight to the lungs. That is what happened in arterial septal defect. Imagine we have a situation where there is a blood clot. Which we normally refer to as a paradoxical embolus, where there is a blood clot in the inferior or the superior vena cava. Such blood clot will pass through and enter the right atrium. Now that it enters the right atrium, such blood clot will pass through the whole, the septal defect. It will pass through the septal defect to the left atrium. From the left atrium, it will move straight to the aorta. From the aorta, if it happens to take an artery, that is going straight to the brain, it is going straight to the brain. And when it gets to the brain, it is going to cause stroke. Most of the times, arterial septal defect don't usually have any signs and symptoms. Sometimes it is asymptomatic. But what is associated with this is the paradoxical embolus. 2. It can also cause pulmonary hypertension. It can equally cause cardiac arrhythmias. If after childbirth, a doctor uses a stethoscope to check for the lap-dap sound. The lap-down sound is just talking about the closure of the semilunar valves and then the atrioventricular valves. There will be alteration in the lap-dap sound. You will not hear the lap-down sound as normal. There will be alteration. And if he happens to hear it in an abnormal way, that means that there is arterial septal defect. It has failed to close after childbirth, and that is a defect.